types of telehealth are you doing? Is it primary care or along each of the different disciplines that you support, or how are you doing that?
So right now, it's just been predominantly primary care.
Yep.
And we're now moving into the behavioral health telehealth. But as it started, it was just really primary care, in which that alone is why we were able to have Tryten be so successful in our organization, because we were able to just throw our telehealth application onto iPads, onto your stands. And then that gave us the flexibility to be able to do what we need to do. We didn't have to worry about wind knocking these stands over because they were so sturdy. We didn't have to worry about power because there's power built into, you just plug it in and there's power adapters built into the actual apparatus. So, when we looked at stuff, and again, that goes to the quality. We're not looking, because we could have went to Amazon and brought iPad stands that rolled for $100, but is that quality? And that goes back to the moral perspective that I come in when I'm dealing with anything from a technology perspective. Is that something that I would want to have in front of me? No. So we went to Tryten and said, not darn the cost, but really darn the cost. Is it the best? Is it quality? Because that's what our patients deserve. And that's how we chose your solution. And we'll continue to do business with you all because of the quality of products that you make that really make it a medical grade apparatus or structure, depending upon what product service that you offer. And so, I don't want that to be remiss in this conversation, is that if you don't know what quality is, then you don't successfully treat your patients well. And the same thing is for your providers, because they have to use as well. Doctors don't want a flimsy system that's tripping over the rug or, has the ability to fall. They want something that's quality. They want to sit in front of it and be able to, easily maneuver it up and down according to their height. And that's what our doctors were able to do in a mobile situation with your solution.
So how has the cart been received by the patients?
The patients love it. So they actually say, so, wow, oh, this is nice. And, when someone says that, they really mean it. So I think that's the reaction that I look for and I get. And even from the provider perspective, they say, oh, it was funny that we were rolling them around and putting them in different places within our buildings as we started to slowly open back up. And they're like, this thing better not talk to us. Because they look that good. And they think they're so robotic. They're like, this thing better not talk to us. No, it's not going to talk to you. But they say they love the sturdiness of it. They love the fact that it's so compact. And it makes you want to use it because it's presented in a nice way.
Yep.
There's always that saying of, you can give me a steak on a trash can, and then I would throw it away, because of the presentation of it. So the presentation of these carts are so well received that they're looking at it as something they want to use because of the presentation. It could be a steak on a garbage can and they wouldn't take to it, but I think this is a steak on some China. So the implementation process, it was probably my easiest implementation of all, because again, to my aforementioned statement, is that they just look so nice, they perform so well. People automatically really know what to do with them, so it was more on the telehealth implementing that solution than the actual carts. The carts were just the supporting apparatus that they saw as, okay, I just need to do my telehealth on this. And you actually almost are wanting to do it on there again because of that kind of implementation. So it really wasn't a heavy lift at all. And we just took my guys a few hours to put them together and rolled them away.